Thank you, Bibas, for the introduction and the invitation. So, my name is Peiling. I'm happy to be here with you guys this afternoon. So, I'm going to do a very non-technical talk because I'm coming from an epidemiology, public health point of view. So, in case it gets too boring, just bear with me. So, what I'm going to show you today is just some of our work that we have been doing on syndromic surveillance systems. So, maybe just a quick background in case some of you are not so familiar with influenza. That's the flu, that commonly known as flu. So worldwide influenza epidemics. Oh, okay, like that. Okay, worldwide influenza epidemics account for approximately 3 to 5 million cases of severe illnesses every year. In Singapore in particular, it affects about 20 to 25% of our population. And so every year, about 1,500 people are hospitalized and 588 die due to influenza. So if we really just treat the patients and wait for them to come to us, such a strategy actually, we did, one of our colleagues actually did a simulation. It actually causes quite a bit of deaths, hospital days, and also work days lost. So also bear in mind that not just influenza, but Singapore being a global hub for travelers, there's a lot of pandemic threats that we're seeing coming around the world in Singapore. So if we look at the World Health Organization, some of their recommendation is that in order to monitor influenza trends, it's better to have a comprehensive surveillance pyramid, which actually ranges from the community to national hospitals. So these are the ones that we can easily assess in the sense that, as long as a symptomatic person visits us, we can basically say that we can test them for influenza and get them into the surveillance database. But that itself is not efficient because we still have a big community base that we're trying to assess here. Because as you know, a lot of us, when we have flu, we don't really go to the doctor if it's not necessary. We usually just try our own remedies and try and get it over. So we do want this to assess this part of the pyramid. And we thought, okay, maybe if we come up with quite a rather straightforward surveillance system, it might help us address the base of the pyramid. And Singapore being so, everybody has a smartphone, we thought to, have a digital system that can actually do that. So we actually came up with two. FluMob is the first version of our mobile app. And where we tested it was among healthcare workers. And we also at the same time collect biological samples so that we can actually characterize the influenza viruses. And then we thought, okay, now that we have sort of trialed it in the healthcare workers, perhaps it's time to go into the working adults, and that's when we came up with FluTech, which is the second, more advanced version of our mobile app. So maybe I just go through the first FluMob with you guys. So the objectives of the study was actually to pilot test this mobile app, which basically serves as our surveillance system, which is the idea behind it is actually to get the person to use this app to report every week to tell us if they have influenza-like symptoms. We think that such a system can provide early warning and real-time monitoring of influenza. And so what we did was we recruited 700 workers from 2 major hospitals in Singapore, and we followed them up for 18 months. Sorry. And so our study participants have to be 21 years old and above, and they have to, of course, own a smartphone. So this is how the interface looked like for FluMob. It's very simple. They can create their own profile. They do the weekly survey here. We have a tab which tracks the number of surveys they are taking, submitting, and we remind them of the next survey that they have to do. So they have to submit a weekly survey here, which basically takes less than 1 minute if they have no symptoms. So all they have to tell us every week is that, do you have any symptoms? If no, great, thank you. If yes, we have to ask them a few more questions about their symptoms, about whether they have sick care, so more the medical symptoms and whether they have sick care. We also have, like what I said, this tracking page where we encourage them to fill in, to submit weekly because what we do is we actually incentivize them with cash or with shopping vouchers such that they will actually provide this weekly submission. Sorry? Yes, we do have a list of the symptoms that they can choose from. So as long as they have these symptoms, they will tell us that, yes, I have this in the past week, so da-da-da. And so what we do, so we recruit them, and then we say, okay, download the app onto your smartphone, and then just report every week for 18 months. Out of these 18 months, 1 year of it is with incentives, but we thought to also have it for 6 months of incentive-free, just to see how the transition goes. And when they start developing influenza-like symptoms, they're supposed to report in the app. And once they report in the app, our study team will actually contact them and say, hey, would you like to provide a swab, a nasal swab, and also a blood sample? This is for us, more for our end, to sort of characterize the virus, to actually see what type of virus strain is being circulated. So, yeah. It's only random sampling. Subsampling, yes, not the full, because we have quite a lot of people reporting. So it's also mainly due to budget constraint that we did a subsampling only, yeah. So yes, the basic recruitment, when they are filling up their profile, we basically try and get like demographic details, their workplace information, lifestyle behaviors, medical history from them. And when they report positive, we will try and swab to get a nasopharyngeal swab from them, as well as a blood sample from them as well. So we also have what we call a convalescence blood sample. That is again for us to trace, whether they actually do have the flu or it's just some other respiratory viruses. Yeah. I mean, these are healthcare workers, working adults. So I guess by the time you are above 21, you should have influenza once before.
So when you recruit them,
yes. No. So there's no, because flu is, I mean, it's quite common. So it's hard to say, oh yeah, you can't have flu for the last 3 months or so. But yeah. So later you will see there's something else regarding that. So anyways, let's go to the demographics quickly. So there's a lot of female in the hospital setting. Majority of our participants are from 21 to 40 years old, mainly Chinese. So the interesting thing, which is kind of related to your question, is that actually a lot of our healthcare workers are very well vaccinated. So if you were to look at the Singapore population, they are about like 10% vaccinated of the whole population. But within our cohort, we get an 81%. So in that case, like you said, if they do have influenza, and when we swab them, sometimes the titers of the viruses might be a bit tricky for us to decipher whether this is a real influenza case or it's due to them having a vaccination, in the midst of the study, because we always have vaccination drives twice a year in the hospital. So yeah, that probably sort of is related to your question. Most of them are nurses and allied health. So what we got, so this is the weekly reporting rate. So this is how we recruited the people. So it took us about 20 weeks to recruit 700 people. And this is the number of participants who reported. So actually what happened was that we partnered with the National Technological University to develop this app. So actually the person who developed the app, I mean, we provided the sort of concept, but the engineer actually came from NTU. So what happened was that I think around this time, I think there was this hacking of the university servers, and NTU server was just down the whole time. So that's why there was this sudden sort of downward, thing with the reporting, and then it stopped for a while.
So, any technological industry is the second largest.
Yeah. Yeah. So there was a technical glitch. The servers was shut down, and then finally it was resumed. So this whole shutting down period was very, very disruptive for the study. It would have been very interesting, as you will see later, if this hasn't happened. Basically, once it was shut down, we had to inform all our participants to inform them, because actually a lot of them came forward and said that, oh, I want to submit my weekly surveys, but it's not taking in my surveys. But after we resume, interestingly, there's still about, as you can see, the percentage of participants, right? After we resume, there's still about like 20% who still, continue to submit their surveys. And so, yeah. So I think in terms of the reporting and just the whole idea of getting people to report every week if they have symptoms or not, for us, about 50% seems to be relatively okay. It's not too bad. If we have a bigger database, if we have a bigger participant pool, if we can get 50% of them reporting. We have a push system, and we also, every week, so depending on when they are enrolled, every week, we will send out notifications, like how you have like WhatsApp notification and like on your phone. So we'll send that out to them and say like, oh, please, and we will just keep pushing until we'll push for like 1 or 2 days, and then after that we'll stop. Yeah. So in terms of the symptoms reported, of course, it's what you expected: nose, runny nose, sore throat, cough. There's quite a bit of cold symptoms, which indicates the severity of the illnesses. So this is in Tan Tock Seng Hospital, that's where our national center is based. We actually have a medical lab, and whoever is admitted into Tan Tock Seng with influenza, we actually get their blood and everything, and we confirm that they have influenza. So this orange line is actually the lab confirmed influenza cases among our patients. So you sort of like see a trend, because Tan Tock Seng is quite a big hospital as well, and it's located centrally. So you see that trend in our patients, the flu trend. And the blue line is the line that our participants reported influenza-like symptoms. So as you can see, we don't have any statistical tests, but you do see like similar trends. But this glitch here would have been interesting for us if the glitch didn't happen, because we will be curious to see if there is like a big jump here with the reporting. No, I don't think so. I think it's probably one of your winters of the northern or southern hemisphere. Yeah. Or
sometimes higher, but
yeah.
the question is that the orange line represents everybody, not just your cohort.
Yes. So the orange line is actually not our cohort. Orange,
not just your cohort.
It's not even our cohort. It's what I would say that it's sort of like a general population, because it's patients reporting to us. And because we are so centrally located, I think it's sort of like a good proxy for the general population, yeah. Yeah. And probably we see a lot more older patients as well, yeah. Non-vaccinated patients, yes. And so our cohort here, we see the more vaccinated participants. But bear in mind also, because they are constantly being exposed to the patient, so we see them also at a higher risk of developing influenza as well. So that's that. We are still in the midst of sort of writing up the manuscript, and So then we went back to our drawing board and we started thinking like, okay, healthcare workers is easy, right? It seems like there's relatively good uptake, and it lasted for 18 months. But how about working adults, people who are not healthcare oriented, people who don't have that sort of conscious, civic consciousness to say, okay, I want to do I want to report my symptoms so as to contribute to a better understanding of influenza in our country, right? So we said, okay, let's target now working adults who are at higher risk of exposure to influenza and other acute respiratory infections. So we went to Changi Airport. We went to a lot of restaurants. So the waitress and the waiters, Changi Airport, the service staff. So we said that, could you give us, could we recruit from your sites? And we managed to partner with quite a few restaurants and airport. And so the study lasted for 4 months. And we recruited about 100 over adults, mainly due to budget constraint, not so much that we didn't have the participation. But yeah, so mainly we recruited about 100 adults, and we just wanted to really see how the uptake is like among this group of people. So just to show you the app features that we have now with the second version of this system. Of course, we still have the weekly survey. We also have this thing, what we call a GP clinic. Later, I'll show it to you. We have also a more interactive thing about flu facts, just to educate the public as well. So yes, the weekly survey. And then what we have now is we actually say that, okay, when you report positive, right? We actually show you, where are you now and where are the nearest GP clinics. And if you click onto each of this button, it will show you the opening hours and the phone number to call to make an appointment. So we want it to sort of be a little bit more interactive, such that people will not just see it as us trying to get data from them, but also them sort of benefiting from being part of this study. And what we have here again is then we will update this map. So whoever report cases to us in the 5 major regions in Singapore, we will update that into the Singapore map as well. And then this is the education part that I was talking about. We have flu facts, so bite-sized information on diagnosis for flu, symptoms, prevention, treatment, some statistics as well as a history. And what we then did was we actually, so maybe I go to the next slide first. So what we then play around with was the reimbursement scheme. So previously for the healthcare workers, it was very straightforward. You just report, and for every, say, 10 surveys that you have reported, we give you, say, $5 or something. But what we did now is we try to play around with sort of at an individual level and a company level. So because we are going into companies, we thought, maybe we can make use of company dynamics to encourage each other to participate and to remind each other to submit your weekly survey. Because we noticed that in our previous flu mob, even though we were sending out notifications, some of our participants actually, in the end, turned off the notifications. Some of our participants basically just ignore the notifications. So we thought, okay, maybe we could also tap into, your peer pressure to get people to submit. And that's why we also have, when it comes to tracking of the number of surveys, we have it at an individual level as well as a company level as well. So yeah, just a little bit of a preliminary result here. So as you can see, the vaccination rate here is very, very low. Only 2.7 were vaccinated for flu in the past 1 year. About 57% of them never had a flu vaccine. They said that they had a flu vaccine, but they cannot remember the date, which means that probably it was more than a year ago. And yeah, and 41% of them never had a flu vaccine before. So yeah, and we are talking about working adults. So this was only 4 months. Yes. Yes, to submit your weekly survey. So yeah, and because it was only 4 months, we did get a pretty high reporting rate. And I think a lot has to do also with our company tiered reimbursement scheme. that encourage people to submit. So actually we got a pretty high submission rate. Positivity rate for flu symptoms is about 12%. Yeah, so moving forward, so actually there are a lot of this, what we call community-based flu surveillance systems around the world. In Australia, it's actually called flu tracking. In the US, it's called Flu Near You, and in Europe, it's called Influenza Net. So we are in touch with these groups, and we thought eventually if we are able to build out a big database here in Singapore, it will be interesting to actually integrate our data with these other systems, because Singapore being in this junction, right? We basically get travelers from the north and the southern hemisphere, and it's not very seasonal for us. We basically get it like all the time, the flu cases. So, and we are in collaboration with partners from University of Colombo in Sri Lanka. So we are thinking of expanding the flu tag to Sri Lanka, and that's still pending. I think ultimately what we want to do is, because coming from the National Center of Infectious Disease, we thought it would be nice to have a platform for people to report just basically symptoms coming from any infectious diseases. So that in case of, let's say, dengue or Zika, we get that really real-time warning from the community themselves, rather than waiting for the first case or the first GP case to show up. We hope to actually get that sort of community participation to help give us the early warning signs. Yeah. Yeah, so for example, if let's say under our list of symptoms, we could have a list of symptoms, because like in terms of infectious disease, there's many symptoms, right? But if we can have a list of symptoms and we can have algorithms that say, okay, if a person say that, oh, I have fever, muscle ache, and some red spots, and then that's maybe a warning for dengue or Zika. And if you have this, then it gives you a warning for this. So that's how we hope that it could be, used for surveillance purposes. And yeah, so that's the end. So this is our research team at the National Center for Infectious Diseases. At NTU, we work very closely with Prof. May Olun. She's actually from the Wee Kim Wee School of of Communications, and she worked in healthcare communications. In NUS, we work very closely with Alex Cook. He's also a statistician at the School of Public Health. Yeah, tomorrow, I think. Yeah, so, and I thank you for your kind attention. So. Yes, so actually what we tried to do is, so a big part of this are the doctors. They are not too keen on reporting every week. A lot of them joined the study also because, well, it's a hospital study and they thought to show support, but then that never really drive, they just sort of have the app on their phone and then they forget about it. We try our best to kind of remind them, but it doesn't. So actually what we try to do is, after the study ended, we actually did what we call focus group discussions. So we invited participants who are enthusiastic, the high users, the low users, the middle users, to come forward to have a chat with us, a group of 8 or 10. And the problem is the low users, it was very difficult for us to even schedule a focus group. So we never could reach out to them and say, look, like what actually, caused you not to participate. We have a lot of good responses from the high users. They came and they talked and told us how much they liked the app, but it was just sort of impossible to get back the low users in. Yeah, so yeah, we're not so sure as well. Yeah. Yeah. Sorry? Try. So at an individual level, yeah. Yeah. Yes. Individual probably will be. Yeah.
One of the important points is kind of push button is available. Like any mobile influencer program, I'm part of a study where we are targeting obese kids. To essentially telling them that what we want to eat.
Yes.
The problem is that, like, if you teach them too many foods,
Yeah.
then
They get a bit annoyed.
they're not going to get anything in anything. They're getting fatigue. So in standard clinical trial, in drug trial, we do something called PPPD, like the dose versus toxicity kind of balance.
Yeah.
I mean, in this kind of e-health trial, there is no toxicity. But there is dose, because how many times you're sending the message, right? That's your dose. So what we are right now working on the fatigue. It is kind of universal.
It is.
So this is interesting, like in any behavioral trial, when you are doing this kind of autonomous thing, you have to model somehow that you don't send too much food.
Yes.
But don't send too few. So basically, that's kind of, but it's not done.
No.
In behavioral trial, it's not done. Like, what is the optimal dose?
Yes.
That's important.
So actually, that's quite interesting because actually we have another study which actually look at community resilience in events, in pandemics, in the event of a pandemic. And what we want to do is something similar. You have an app or cohort that you can basically poll quite quickly in the event of a pandemic. And you can, first of all, you recruit them when it's non-pandemic. You get all their baseline, you get all their knowledge, sort of baseline knowledge on how they will react in a pandemic, what do they think of government messaging and stuff like that. And then eventually you keep them engaged. And then if, let's say, we do have a big thing like SARS or whatever, right? You can then poll them again and then see how their knowledge changes or what are their... But that's what we are worried about is the fatigue, right? How do you keep them engaged without pushing them too much? And actually, even being part of the study actually already sort of bias them in a way, because I'm sure if you're part of a flu study and if, let's say, we have flu facts, you will read up and you will, get to, educate yourself more about IDs when more eager and so.
There is also another attempt, clinical trial, you can treat.
Yeah.
So there is a concept called you can drop off.
Yeah.
So basically, there will be doctors or who are too busy or some reason, they have tendency that, I'll do it, but I'll not do it. Basically, I'll not do it.
Yeah.
So if you can identify this subgroup that you will not do it, so can you do something different? Because they will not do it, because it shows arbitrarily that they will not do it. So I think the question is how much micromanagement.
Yeah. So actually, yeah.
Something else, right? Yeah, maybe this is not the right one for that.
Yeah. But actually, worth mentioning is that in Australia, the system that I mentioned just now, flu tracking, in Australia, they actually get 20,000 working adults reporting every week. And I think a lot has to do with the sort of the civic mindedness of the population. And they are doing it without incentives. So what we're doing here with our pilots are actually quite unsustainable. We're trying to sort of not bribe them, but we're trying to say, hey, look, if you support and,
And it could be a situation that you get community level indicators of the community health. For example, in one big drop, maybe, but you may not need to talk to them. You need to have responsibility for it.
Yeah.
It should be good enough.
Yes. Yeah. Thank you.